Welcome once again to CoverStory Highlights, raw, unapologetic, and grounded in truth. Today we are going to dive deeper into the issue involving the $31 million neurosurgical drill that was bought by the Jamaican government for the Bustamante Children's Hospital. The issues surrounding the neurosurgical drill purchased by the government of Jamaica, facilitated through the Southeastern Regional Health Authority, SARA, has stirred significant public debate in recent weeks. Health and Wellness Minister Dr. Christopher Tufton, addressing the controversy, has sought to distance himself from the cost of the equipment. Instead, he has emphasized the procurement process used to award the contract that brought the drill into the island. However, opposition spokesman on health and wellness, Dr. Alfred Dawes, has focused his criticism squarely on the price for the drill. Dr. Dawes contends that the $31 million disbursed by the government is vastly inflated. He's urging all Jamaicans, both here at home and in the diaspora, to search online for the Medtronic EM800 series neurosurgical drill, which the supplier identified as the acquired model. According to Dawes, anyone conducting such a search will see that the drill's cost appears to be inflated by more than 20 million Jamaican dollars. Let us now hear from Minister Tufton as he addresses the issue, followed by Dr. Alfred Dawes in his response.
I have tried to avoid making too many public pronouncements on the matter, because I have spoken before, and indeed SARA, which is the Southeastern Regional Health Authority, which oversaw and managed the process of procurement, have been dealing with the issue. The matter is getting a lot of airplay. I'm not sure why, because from my perspective as minister, my responsibility is to inquire about the process. And with all the hype around the conversation involving the particular instrument, I have not heard up to this point anyone questioning that the process was somehow breached. In fact, up to this morning, I got and reminded myself about the report that was received about how the matter was managed through to the final determination, and that involves a tender document being issued, having been developed, involving a panel that involved neurosurgeons who use the instrument, an advertising in the public domain for all and sundry to apply once they are registered with PPC, which is the law, 3 bidders submitting a bid, those bids being examined, a determination made by an evaluation committee, and then, based on a recommendation, a further examination by an external party, the Public Procurement Committee, PPC, and then they validating that process. And then the award is taken. From my perspective as the policymaker and the person who appoints a board, SARA's board in this instance, my role is to always support and ensure that the process is followed. I have never been involved in procurement because that's not my job. In fact, I can't get involved in procurement. I don't know the company up until when this conversation started. But as I understand it, they are a registered company. They have been in business since 2007, before I was even a minister in the Ministry of Agriculture. So they have been around for a long time. And the principals, as it is their right, participated in a process and have a right to defend their position, and they have so done. Beyond that, I can't comment. It seems to be a matter that may end up in the courts based on what I've heard in the news, which then further restricts any further delving into it. But even so, I would not be tempted to do so, because my view is that if the process was followed, that really is what matters at this point in time. The only other point I'd make is that 2 weeks ago, I did a tour at Bustamante Hospital for children, where it really matters, and spoke to 2 neurosurgeons and the rest of the clinical team, including the SMO, who were present. And they took me through the process of understanding what this piece of equipment meant to them. 2,500 surgeries a year, and they said to me up to half the numbers, which means maybe 1,200, based on what they said, could benefit from that piece of equipment, because the equipment was not just a drill, but it had several components which allowed them to participate in at least 5 categories of surgery. And they were very adamant, they were passionate about the value of the piece of equipment. It saves lives. That is what matters to me. What matters to me is that the process was followed and that the equipment is being used to enhance the services in the hospital, Bustamante Hospital. And therefore, from my perspective, the matter is closed. We're moving on and we're doing other things to save more lives.
Okay, but before you close it, Minister,
Yeah.
I guess the process was, you're satisfied with the procurement process.
Sure.
But I think the issue is the cost. That is what is being, branded about. Are you satisfied that that cost could have, could have been, is that cost okay in your estimation,
No.
or could it have been less?
So first of all, I am not in the business of supplying, manufacturing.
So you're actually more
I
satisfied.
know, that's why I'm coming to that. I'm not in the business of understanding, manufacturing, or otherwise surgical equipment, right? I don't know anything about surgical equipment. So what is more important to me is that the process has integrity and was followed. And that is where I think my fiduciary responsibility lies.
So as a lawmaker, you're not concerned about the fiscal aspect of the...
No, this is where again the hype is guiding some of the judgment that many are applying to this process. The process that involves a scope, tendering, and evaluation is supposed to address value for money. So that's what the framers of the rules would have anticipated. So to the extent that the rules were followed, to my mind, should give all of us some reassurance that based on what was required and what was provided, those costs would have justified based on the process taking its course. Now, if you had said to me that somebody just went to a side and go negotiate with somebody, then you would have a lot more questions around value for money. But the whole procurement process, just to be clear, justifies the end result by virtue of the process being followed. And so I am not going to get into the machinations of having an alternative. For starters, people can't bid unless they are registered with PPC. We can't get involved in a situation where we go look for an item and say because it's cheaper, they must come and supply us. The process don't work like that. The process says advertise, this is what we're looking for. You come express your interest, we examine it, and we find the best. And that process was followed.
Which would have been the cheapest manufacturer or the cheapest...
Not cheapest, and that's the other issue that we have to be careful of. This is not an issue around cheap. It's an issue around what is required versus what is supplied. So I think we're getting carried away on this cost issue without thinking through about what was asked for and what value was
provided. I
provided.
would agree with that, Minister.
Yes.
It's because you use the example of brand.
Yes.
In some instances, you can get a brand that provide the same function,
Yes.
at a cheaper cost.
Yes.
This equipment that we're talking about, aren't there any other equipment, any other brand cheaper than $31 million that could provide the same services?
No. Again, you're asking me to comment.
You're
commenting. You're making assumptions without listening to what I'm saying. I'm saying to you, the process should pull that out. If there were cheaper alternatives, then that cheaper alternative that created that similar value would be one on top.
But we haven't seen the three companies that bid for it, Minister.
Access to information, you probably can do that. Access to information.
All right.
You go and ask the procurement process. I mean, there's a process for that too, right?
That was Health and Wellness Minister Dr. Christopher Tufton. Now, let's listen to Dr. Alfred Dawes, the opposition spokesman and Health and Wellness. He's also the constituency caretaker for South East St. Catherine. Dr. Christopher Tufton, in an interview, suggested that the procurement process, that nobody has come out and mentioned that the procurement process was breached in any way. And he also said that he's satisfied with how it was done, and he's more concerned about health and the lives of people than hype. You care to comment on some of the issues he raised in that interview?
Well, firstly, I care a lot about health, which is why I'm doing this. And as one former leader said, it takes cash to care. And healthcare needs money and a sustained input of money to finance the provision of care for patients. Now, I have mentioned before that I have serious questions concerning the procurement process. At face value, it appears that the procurement rules were followed. A tender went out, registered bidders made their tenders, and then a selection committee selected the bid that offered whatever was needed for the best price. It seemed like it makes sense. However, the problem came when they torpedoed the process by the internal estimates. Now, we are aware of the exact brand, not another brand that can do the same work, but the same brand, the Medtronic EM800 Neurosurgical drill. We just found out that that is a brand that was supplied, and anyone can do a quick Google search and realize that this machine is about a $3 to $5 million machine. However, someone at Sarah in the procurement process, and I asked the chairman specifically who it was and how did they come up at that estimate, but someone determined that a fair value for that drill was $32 million. And that is where the entire process was breached, because there is no one with any fiscal sense who can say that $32 million for a drill where you can find a quick Google search showing that it is $5 million makes sense. And from there, all one had to do was to make a bid, follow the guidelines, and then if your bid was lower than $32 million, you would be selected. Now, I am privy to the bid documents, and I know that 3 companies bid, one for $12 million, one for $31.5 million, and another company bid for $50 million. The $12 million company was eliminated because they didn't provide all that was needed in terms of the necessary attachments, which left the poor doctors and biomedical engineers, the technical team, evaluating the bids to determine which one was better to go with the lesser of the two evils, which was a $31.5 million drill. And Sarah was able to say that it came in at a discount to what they expected it to be. Now, I am extremely uncomfortable with that process. And it doesn't matter how much they will tell you that it is above board and the rules were followed. Something went wrong at the initial stage where someone decided on their own, and I doubt with any form of support in documentation, price comparisons, that $32 million is a fair price to pay for a $5 million drill. And that is why the process, in my opinion, and in the opinion of many who have heard exactly how it went, that is a breach in the procurement rules, and it was hijacked.
He also says that the drill in question, it is a multifaceted drill. It performs multifunctions, and the doctors at the Bustamante Hospital assured him that it is working for them in terms of, getting emergency surgeries done and other related surgeries. Can you comment on that?
I fully support the doctors in saying that this is an addition to the armamentarium that will save a lot of lives and make surgeries much more easily performed. as well as to increase the number of persons who can benefit from surgery. My issue is the cost and the opportunity cost. We are spending $31 million on a drill that could have been bought for $10, $15 million if you're talking about a decent profit margin. And I'm not against profit. What I'm against is rape, and this is financial rape. But we'll have to focus not just on the benefits of the drill, but the benefits of the money that we overspent that could have been still in the system to provide other drills in other hospitals, to provide ventilators, beds, to help complete the overnight facility, to get more bed space, to pay staff, to pay suppliers so that they will not hold on to necessary sundries and goods because they have not been paid. And that is a problem. Money was sucked out of the system unnecessarily so, and nobody can explain why it was done so. So the cost is an issue, and not just the actual cost paid, but the opportunity cost of spending so much money on that drill when so much is left to be done to fix the public health sector.
So Dr. Dawes, you're categorically saying that the drill that was bought, and you have researched it, and it you can get it for $8 or so million. Does that drill perform the same kind of functions that the minister alluded to?
We're talking about the same model, the same attachments, and it's probably going to come up to about 30,000 US. Add some attachments. If you go all out, if you want to get a fully loaded drill, it's still not going to come to $10 million. And we're talking, and we're not guessing to see if it's a similar brand. We're talking about the exact brand, and anyone can research the EM800 to see the cost.
And you're saying, sir, that you have documentation to prove that it is the brand that they have
Well, the company themselves, they issued a release stating exactly which brand it was that was brought in. If we spent $15 million and that drill did what it was supposed to do, I would be happy. We would not be having this conversation. The fact that we spent $31 million is the issue, because we could have gotten 2 drills. We could have doubled what that drill is doing now. We could have tripled what that drill is doing now. I know that the principals of the company Meditech, I know that they know what I know, and this is why it is very surprising to me that they're pursuing this legal action, because they know if what I know comes out in court, not only will I be proven right and vindicated, but it will destroy the reputation of that company permanently. Letters were sent off to the Integrity Commission as well as the Auditor General, and I'm prepared to sit with them and share some of my findings that I have concerning the operations at Sarah surrounding the procurement of this drill and some other contracts that involve the company in question. And I must say that it is quite alarming that so many people are trying to distance themselves from that company. Now, the minister is saying that he never heard of the company before this news broke. And I find that quite unbelievable. I'm actually shocked and appalled that the CEO of the Ministry of Health never heard before of this company that it does so much business with. As a matter of fact, the Ministry of Health has done so much business with Medical Technologies Limited that it was on a list of companies that went to Parliament for parliamentary approval, given the size of these contracts. So I'm wondering if the minister, not being aware of such a major partner in the provision of healthcare, if this is gross negligence or incompetence on his part, if what he says is true.
And that was Cover Story Highlights. Join in the discussion. Say what you think. In the meantime, please share this video, like, and comment on the issues that were discussed.